Hey, welcome to the Women's Room. This is Carrie Brandenburg, and we're doing something a little bit different today. We are taping this show because it's a very important show. You'll be hearing it later, so there will not be music. Bob Walpole, our producer, usually plays some pretty wild and crazy appropriate music for our topic, but there will not be any music and there will not be any telephone calls. So we're sorry about that, but we just think that this is a very important show that we're doing, and we wanted to go ahead and do it. November is Pancreatic Cancer Awareness Month, and thus that is our topic today. It's a cancer that affects more people than you might imagine, and it tends to be terminal more often than not. And we don't want to be kind of down about it, but that's the reality. As our guest, we have Alesia Cappon. And Alesia, I'd like you to say something about why you're here and your family members.
Thank you, Carrie. I'm here because I lost my grandmother, Barbara C. Cedillos, to pancreatic cancer in 2009, and my mother, Barbara A. Cedillos, is currently battling pancreatic cancer. And they have given me permission, well, not my grandmother, but my family has given me permission to discuss this very important issue and their experiences.
Okay. And because of that, we're going to dedicate this show to Barbara Ann and then Barbara, your mother and your grandmother. And I think that's a very important thing. So that's one of the reasons why you're here. We're also joined by Dr. McAneny, who is CEO at the New Mexico Cancer Center, and she's a practicing oncologist.
Yes.
Welcome, doctor.
Thank you very much for having me talk about this important disease.
Well, this is a very important topic for you. And Joshua Rogers, again, his mother died from pancreatic cancer, and he started the Poly Run, a fundraiser in her memory.
Yeah, thank you for having me, and it's a special month. It's Pancreatic Cancer Awareness Month, and so it's a great honor to be here and to talk about pancreatic cancer and Polly's Run and our local group, the Pancreatic Cancer Action Network group here in Albuquerque. So thanks for having us.
Okay, now I don't think, Doctor, how often or in what percentage of people or what is the cause of death in terms of cancers? Where does pancreatic cancer fit in there?
Pancreatic cancer is the 5th most common cancer.
Okay.
It does result in a fair number of deaths because it's harder to cure than breast cancer and lung cancer even, and colon cancer, which are the more common ones. But pancreatic cancer, because it starts in an organ that's deep in the middle of your belly, is harder to look at. It's harder to screen for. You can't poke on it like you can find a lump in your breast. And it often doesn't create symptoms until it's at a more advanced stage.
Okay, so just give us an idea. It's a cancer that is one of the leading cancers that causes death across the world and certainly in our country. But what are the statistics in terms of people surviving pancreatic cancer?
It really depends on how early we find it, and the difficulty is the majority of the time we don't find it early, so probably fewer than 10% of people are actually cured of that. You need to find it at a time when you can either take it out directly or shrink it enough with chemotherapy and radiation that you can then take it out.
Okay.
And so that requires early detection. The problem is we don't have a good screening test that will allow us to find these things at an early stage. By the time people have symptoms, they often either have blockage of the pancreatic duct, which causes pain and indigestion, or they have weight loss. One of the things that people should watch for, though, is if you're a healthy person, an older person, because it's usually an older people, who suddenly starts developing diabetes, because the pancreas also makes insulin, and if the pancreas isn't working well, you don't make as much insulin and you become diabetic. So if somebody becomes diabetic, it's something to think about. If people start losing weight, most of us who try to lose weight struggle with it, but if the weight starts dropping off for no good reason, that's time to go and look. But those are pretty nonspecific symptoms. Diabetes is common. People losing weight can be from depression or other things going on, so it's not an easy diagnosis to make.
And I think more than half the cases occur in people over the age of 70.
Yes.
So, okay. Now, Alesia, would you like to tell us your story, or not in great detail, but, why you're here and your experience?
Well, before my grandmother was diagnosed in July of 2009, I don't think anyone in my family even knew what the pancreas was or what it did or how important it was to our body. She was one of those who was diagnosed late, and we lost her within 3 months of her diagnosis. She had some of the symptoms that Dr. McAneny was talking about, although she was a diabetic before. She was 76 when she was diagnosed. And in 2013, my mother was diagnosed, although we were well aware of what the pancreas was, how important it was, where it is, and the function in the body. And so that had been in our mind that the same organ was acting up. She had pancreatitis, which is one of the symptoms. And I think we had to just wait till the tumor was big enough to pick up on a scan to get the diagnosis. But she's been 20 months surviving, so that's kind of an anomaly. My understanding is that 75% of the people who were diagnosed in 2013 have passed away. So she's one of the lucky 25% who is still living.
And she's living independently, isn't that true?
She is. She underwent aggressive treatment at New Mexico Cancer Center. There's important veins and arteries that are nearby the pancreas, and those were starting to get involved with this tumor. So she underwent chemotherapy and radiation to see if they could pull that tumor back enough from those arteries to have surgery. And so that was quite an aggressive, long 2013.
Right. Okay.
Yes.
And Josh, do you want to share your
Sure.
experience?
My mother was Polly Rogers, and she was diagnosed in late September of 2008. She was 55 years old. The original symptoms started in late June, early July of that same year. It was misdiagnosed for 2 months, everything from pancreatitis to taking out her gallbladder. And she passed away in June 2009 at the age of 56. And it was quick, and, it was one of those things that you don't see coming. She was healthy. She was a runner. Great spirit, and she fought as hard as she could, but this is one of those diseases that less than 10% make it 5 years. And a tragedy among this disease is the fact that a lot of people live for 3 or 4 weeks after diagnosis. It is just a quick killer when it finally gets diagnosed.
And you said she's healthy, she ran, she had an active life.
Yeah, she did everything right, very active life. She was a coach, she was a teacher, she ate right, everything healthy, and it took us by surprise, that's for sure.
Okay, now, doctor, what are some of the risk factors, behaviors that we have that put us at higher risk for pancreatic cancer?
Well, probably smoking is one of the major risk factors. It seems to be just a bad actor in anything that you do. We're learning that almost all the cancers that we treat, from pancreatic cancer to leukemia, are happening partly because of tobacco. A lot of the time we don't know what the other risk factors are. Being older is definitely a risk factor. It's more common in people who've had liver disease or pancreatic disease, pancreatic stones or pancreatitis. But it's not something you can say, I'm at higher risk. Just being a person puts you at higher risk. So my father also died of pancreatic cancer.
Okay.
So it has touched many, many people. And he was in his 80s. That's one of the problems, is when it occurs in people who are very old, they're too frail to go through much of the treatment. I actually brought him from where he lived in St. Louis and brought him here so that we could treat him and take care of him as well. And we got him about 1.5 years.
Wow.
But a lot of the time, you don't get people a lot more time than that.
Okay, now we're going to go to break. This is Carrie Brandenburg. The topic today is pancreatic cancer. Welcome, New Mexico. This is Carrie Brandenburg on the Woman's Room. This is an unusual show in that we're pre-recording it. There will be no phone calls. There will be no music. We usually have great music. November is Pancreatic Cancer Awareness Month, and so that is our topic today. We are joined by Alesia Cappon, who actually works for the District Attorney's Office, and her mother is surviving right now, living with pancreatic cancer. She lost her grandmother to pancreatic cancer. We have Joshua Rogers, who's very active locally, and he lost his mom, Polly Rogers, to pancreatic cancer, and he started the Polly Run to raise money. And we have Dr. McAneny, who is CEO with the New Mexico Cancer Center and is a practicing oncologist. So we've already discussed some of the issues with pancreatic cancer. Why is it so difficult? I mean, I thought, being a layperson, that if somebody has a problem, they go get a CAT scan, MRI or something, they find out what's wrong, and they can start dealing with it. Why isn't that always the case with pancreatic cancer?
Well, we wish we had a good screening test for this, and we also wish we had a perfect diagnosing test. The problem is that when a cancer is 1 or 2 cells, it's too tiny to be visible on any kind of an X-ray, CAT scan, MRI, or any device. It has to grow big enough that the human eye, aided by these devices, can actually see it. And the problem with pancreatic cancer is that because it's deep inside your abdomen, you can't see a lump or feel a lump. There's plenty of room in there for a lump to get bigger before it causes any problems. So we find pancreatic cancer if it's in what we call the head of the pancreas, which is the part that's tucked up under the liver, if it blocks off the bile ducts. Mm-hmm. So if it can squash the bile ducts so that the bile can't get through, it backs up into the liver, and then people get jaundiced, which means they turn yellow. The eyes turn yellow and the skin turns yellow. But by that time, it's already done significant damage. If it sits in the tail of the pancreas, which is further away from that bile duct, it can grow to a much larger size before it blocks off enough that the person has any symptoms. And the bigger a cancer grows, the more blood vessels it's grown through, and the more chance there is of it planting seeds through the bloodstream down into wherever the blood goes, and for the pancreas, that's into the liver. So it's not uncommon to find people at the time when they already have significant enough problems with their liver that it's the liver that causes the symptoms, not the pancreas.
Okay.
So that makes it very difficult to find early. Part of the problem in screening people with these, with CAT scans in particular, is if you do a CAT scan, you're giving people a fairly high dose of radiation. And you're going through giving them contrast material that people, you have to take care of people to get that out of their kidneys, and it's not an entirely easy test to do. But if you do that, first the cancer has to be big enough, but there are a lot of funny looking things that can be in there, so you may have to biopsy people, you may have to do other invasive procedures and then discover that it's not anything. So when we're screening, we always consider how well are we going to take healthy people who have a risk, and how many of them are we going to actually harm by doing a screening test compared to how many of them are we going to help. And so far, the risk of hurting somebody by putting healthy people in a CAT scanner, radiating their pancreas, doing the follow-up biopsies and whatever, is greater than the chances of finding a cancer in its treatable stage. Okay. That's why the U.S. Preventative Services Task Force and other groups are not recommending that we all go out and get a CAT scan every year.
Right. Okay. And I'm going to throw out an MRI. You don't have the same issues with radiation if you're talking about an MRI.
Well, people are looking at whether or not that will make a difference, but it's still, if you have an individual who is very high risk, say has the pancreatic gene or a very strong family history, which may mean that we haven't figured out that gene yet, there are some people who are considering doing ultrasounds or MRIs as a screening test. The other question that you have to think about, though, when you decide to screen people for a disease is this the best use of the country's healthcare dollars? So if you're going to do one thing, that means you have to choose not to do something else. So are we better off spending our dollars doing screening where we know it makes a difference, like colon cancer and breast cancer, or rather than doing a screening test with a very expensive test where you don't know that you're really going to be able to save people from it. You don't know that doing that screening test is going to truly save lives. So it becomes one of those difficult society questions that we're going to have to address sooner or later, or we'll be spending every dollar we have on healthcare.
Right, right. What kinds of things are going on in the, and Josh, I'm going to ask you this, in the area of pancreatic cancer awareness? I know we've got things going on in our community as well as throughout the country.
Sure. One of the best things that's happened for pancreatic cancer was a bill that passed Congress in 2012. It was called the Recalcitrant Cancer Act bill. And it started off as the Pancreatic Cancer Bill, and it was sponsored by the organization, the Pancreatic Cancer Action Network, PanCan for short. And basically what it was is it was a way for Congress to pay attention. It made Congress pay attention for funding for pancreatic cancer. So whereas breast cancer, colon cancer, and all these other really popular cancers gain most of our federal dollars, and the survival rate on things like breast cancer and colon cancer are just really high. Mm-hmm. Pancreatic cancer has lagged behind in funding, and so has the survival rate. So the survival rate has remained unchanged for 20 years. Where what this bill has done, it has made Congress look at allocating new funds through the National Cancer Institute to pancreatic cancer, and also to the other 5 or 6 other cancers that have not received the appropriate funding in the last 30 years from the federal government. So that was a huge win for pancreatic cancer and ovarian cancer and several other cancers. Here locally, the local PanCan group led by Nancy Bowles has taken on a lot of initiatives. We have Pancreatic Cancer Awareness Night at the Isotopes, which this year there was 10,000 people at, and we got to spread awareness through that event and had stats up on the board and met a lot of people that have been affected by this disease. The other one is obviously Polly's Run, which is the largest fundraiser for pancreatic cancer here in New Mexico. It'll be in its 6th year.
And that's your mom. I mean,
that is my mother, and we started with my 2 brothers who live out of state now, but it has grown and grown and grown, and last year we hit 650 people in total. We raised almost $30,000. This year I hope to hit a much higher level. Every year it grows by about 35 to 40%. So, we're doing right things for that. We've also got Pancreatic Cancer Awareness Month, which is going on right now, and we have a lot of local businesses that have put up signs. Scallows has created a drink called the Nancy, which they're giving proceeds of that to the Pancreatic Cancer Action Network. House of Bread, local running stores like Bosque Running Shop and Athlete's Edge are doing discounts for anything that's purple. So if you see someone wearing purple, there's a good chance that it's probably tied to pancreatic cancer awareness. And then one of the exciting things that we're working on right now is with the local ski areas. We are trying to do a Pancreatic Cancer Awareness Day on the mountain sometime early this spring, and what we'll do is we'll paint the mountain purple, and we'll do a silent auction on items that are pancreatic cancer related. And the toughest part about raising awareness for pancreatic cancer is that there are no survivors, and the ones that are here aren't here very long. And so you're left with loved ones of family members that are forced to carry on this message. And it's not like breast cancer where you have a walk with 20,000 people and 19,000 of them are survivors. If you do something like Polly's Run, we had 4 survivors this year out of 660. The other 600 people were someone that had lost somebody or were in support, friend, family, whatever the issue is. And so, you have to find these people out there that want to make a difference, that want to raise awareness and bring to light what's going to happen with pancreatic cancer over the next 10 years. And what PanCan has projected is that even though it's the 5th most diagnosed cancer, by 2020 it's going to be the 2nd leading killer.
Wow. Okay. Well, we're going to go to break, so catch us in the 3rd segment. Hey, welcome back, New Mexico. This is Carrie Brandenburg on the Women's Room. We are pre-recording this, so there will be no music like we usually have, and there will be no phone calls, and I apologize for that because I think it's really important to get your phone calls, and I'm sure a lot of you have concerns and questions. Our topic is pancreatic cancer. November is Pancreatic Cancer Awareness Month, and you may not be hearing this show in November, but it's still important. So when you hear this, pretend that it's November. We are joined here by Alesia Cappon, who works actually in the DA's office. She lost her grandmother to pancreatic cancer, and she has her mom living with pancreatic cancer at this point in time. We have Dr. McAneny, who is CEO with the New Mexico Cancer Center, and she also is a practicing oncologist. And we have Joshua Rogers, who lost his mom, Polly, to pancreatic cancer, and he established the Polly Run, a very successful fundraiser for pancreatic cancer. Okay, I'm going to go to you, Alesia, and ask you, what is it like being a caregiver because your mother is presently living with pancreatic cancer?
Well, Carrie, I can tell you that being a caregiver can sometimes be a very overwhelming and terrifying experience. You're dealing with your loved one and their diagnosis and helping them navigate the treatment options and insurance options, helping them get their affairs together, if you will, and taking on their household as well as maintaining your own families and jobs and things. And so sometimes you're faced with issues about, getting your loved one to treatment, if you will, or caring for them when they're dealing with side effects from chemotherapy or radiation. I'm not a nurse, I'm a lawyer, and so sometimes it's difficult to stay up all night with your loved one, helping treat the symptoms and then having to go to work the next day. So my best advice for people who are caregiving, not only with pancreatic cancer, with any sort of issue with their loved one, is to do your research and don't be afraid to ask for and accept help. Help comes in many different forms. For example, my mom had to go through 30 days of radiation treatment every single day for a whole month, and I could not take off of work to transport her back and forth to her appointments. So I looked into the American Cancer Society, and they have a program called Road to Recovery. We have volunteers in the Albuquerque, Rio Rancho area who would go and pick up my mom at her house, drive her to treatment, wait for her until she was done, and then drive her home. And so that really took that burden off of me and provided, a rewarding volunteer experience for them, and also transportation so that my mom could get the treatment that she needed.
Okay, so there's all sorts of resources through the American Cancer Society?
That's correct. The one I'm describing is called Road to Recovery, and I suppose you could go to the American Cancer Society website and then look for the New Mexico link. And there's lots of ways to volunteer your time and your resources. People are going through treatment, sometimes just need supervision, someone to stay with them to make sure that they're okay, or to cook meals, or to provide childcare if they are parents of young children.
Okay, and let's talk about treatment. What are some of the treatment options, doctor, for someone who has pancreatic cancer?
Well, I think there are a lot of newer treatment options. It used to be 10 years ago that basically if you couldn't be operated on, there wasn't much we could do. Now we do have chemotherapy regimens and radiation regimens that can actually extend life and also improve quality of life, which is very important because we recognize in many cases that this is not going to be a fight we win. And that makes it doubly important for us to make sure that every day is as good a day as we can make it for that patient. At New Mexico Cancer Center, we've really listened not only to our patients but to the caregivers of our patients and try to design everything we do to be as helpful as we can. So we have all those resources. When patients need help, we can either deliver them or find them for them and be able to come up with lots of options. We restructured ourselves in such a way that we now call it an oncology medical home. When you're in trouble, you call home. So we set up our system so that if a patient has something going on, we can intervene early before people end up in the hospital. Because if you only have a limited amount of time, you don't want to spend it in a hospital. You want to spend it in your house and with the people you love. So we designed our whole system so that patients can get in when they need to. We are now open till 8 o'clock at night, and we're open on weekends because becoming ill does not respect time clocks.
Right.
So, for example, if there's a woman who's working and she goes home and discovers that mom isn't doing so well, if you call most doctor offices, you get that if this is a medical emergency, hang up and dial 911. If you call New Mexico Cancer Center, you get a human being on the phone. You get an oncology nurse who has your record, knows what's going on with you, says, oh, you're having nausea or pain or you're dehydrated. Come right in, and we will get that fixed so that we can keep people in their house. We've cut our hospitalizations for cancer patients by half.
Okay.
Which is huge, both for saving the patient's time, which is our most important thing, but also saving the patient a lot of money because the copays and deductibles for hospitalization is huge. So we do much better for people if we can keep them out. So even with aggressive chemotherapies, we are just all over people to try to help them get through this regimen. We have financial counselors to help them deal with that part of it and find resources that they need. We have the on-site pharmacy and x-ray and radiation and chemo in the same place so that we can really coordinate that care and they don't have to spend their time running around trying to figure it out. If people need assistance for the drugs are expensive. We have no control over how much the drugs cost, but we can help patients find ways to get their copay paid for. And we set up the New Mexico Cancer Center Foundation because a lot of our patients were telling us that not only is this a emotional and physical catastrophe, but it's a financial catastrophe. And if you're trying to work and pay the rent and you can't do it because you're sick, you could end up losing your house. So our foundation has the ability, through generous donors giving us money to do this, to be able to pay those bills. So people can stay in their house, patch the roof, fix the truck, do whatever it is that they need to get done so that they can continue their life while they're continuing their treatment.
Okay, we have someone in the DA's office whom we respect tremendously is dealing with a kind of cancer, and he came into my office one day just totally in crisis because he can't coordinate his care with his doctors, with the money, with the everything that he has to do. No one's talking to anyone, and he shows up to get chemo and finds out that he's supposed to be somewhere else, or that he can't get radiation because something's wrong with his platelets, and he actually said having cancer's the easiest part of this.
Right, and that breaks my heart to hear that because we figured out a long time ago that if you are the sick person, you cannot manage all of that stuff. You can't fight with insurance companies. You can't organize your schedule. You can't do that. So we set up a system where the well people take care of the sick people, where we will organize your care for you. We will make sure that when you have an appointment somewhere else that they have all the information that's needed. And when I'm working with somebody who's in a hospital, a physician who is hospital-based, I will not only send the records over electronically and fax the records over, but I'll give the patient a copy of them. We give everybody a notebook so that they have their records so that things don't get lost when I do need to, say, find a surgeon or somebody that we don't have at New Mexico Cancer Center. But mostly, for the treatment of cancer, it's a combination of chemotherapy and radiation, and so we really set up our practice so that those things can occur together and not be racing around town trying to coordinate care.
Yeah, I just can't imagine anything worse than that. And Josh, how much of a caretaker were you for your mom?
I was actually living in Texas when she was diagnosed, and I quickly made arrangements to get back here. And I was in school at the time, so luckily UNM was gracious enough to allow me to transfer in. And I spent the last 6-7 months helping out every day, making breakfast, doing all the things that you have to do. And then my dad would come home and make sure that everything was right. He's a doctor as well, so we were lucky enough that we didn't have to make emergency room visits because we had a doctor in-house, but that is not the norm. And the things that Dr. McAneny is talking about sound terrific, and they were not available when my mom was going through her disease, and I think that's just a tremendous thing for future cancer patients and current cancer patients. So I hope everyone can take advantage of this amazing thing.
Well, that's why actually the Medicare Innovation Center grant was given to me to duplicate what we've done in our cancer center here in Little New Mexico in 6 other practices across the country from Maine to Florida to Texas, Ohio, and Georgia. And it's going very well. We have transformed the way all those practices take care of their patients. And as a byproduct of that, we're keeping people out of hospitals and out of emergency rooms and delivering care so that people can have as much time as they can with the people that they love instead of spending their time trying to get health care.
Right. And Alesia, did you have something?
Oh, I was just going to say that my mom's experience with the New Mexico Cancer Center, the one-stop shop, if you will, I think has contributed greatly to her success and survival.
And that's a no-brainer to me. Anyway, this is Carrie Brandenburg on the Women's Room. Our topic is pancreatic cancer. Join us in our last segment. Hey, this is Carrie Brandenburg, and thank you for joining us during our last segment on the Woman's Room. We are talking about pancreatic cancer. November is Pancreatic Cancer Awareness Month. We are taping this, so there will be no phone calls. And if you don't hear this in November, just pretend that it is November. We're joined here by Alesia Cappon, who is mother is living with pancreatic cancer at this time, and she lost her grandmother to pancreatic cancer. We also have Joshua Rogers. His mother, Polly Rogers, died from pancreatic cancer, and he started the Polly Run, a big fundraiser locally for pancreatic cancer. And Dr. McAneny, who is CEO with the New Mexico Cancer Center and is a practicing oncologist. So, Dr. McAneny, one of the issues that we have in New Mexico, people in Albuquerque have access to doctors and hospitals and things, but in the rural areas, do you do any work in the rural areas or in other areas across the state?
We do a lot. New Mexico Cancer Center has 4 satellite clinics: Gallup, Ruidoso, Silver City, and Las Cruces, because healthcare is local. When you're not feeling well, the last thing you want to do is to get in your car and drive for a couple hours to get chemotherapy. So what we do, because a lot of these towns are too small to really have somebody there full time, and there aren't enough cancer doctors, we have a significant shortage of oncologists. So what we do is we drive or fly to those clinics, see patients, have people on site locally to deliver the therapy, the radiation or the chemotherapy, and we have doctors who come from Albuquerque, go to those clinics, and then come home so that those patients can get their care too. That's really crucial in our Gallup clinic, where there are a lot of people where they're 2 hours from any other services, and we see a lot of pancreatic cancer and its close cousin bile duct cancer or gallbladder cancer in that area. I have no idea why, but we see a lot of it. It's very concerning, and somebody needs to study that.
Okay. And let's talk about cancer research. Josh, you were talking about that in a bill that passed Congress, I believe, in 2012?
2012 is correct. And, none of the funding for that bill has happened yet. The greatest part about that bill was that it was bipartisan, so there was broad support. It was one of the most successful bills in the history of Congress. So there will be funding very soon for it, but the Pancreatic Cancer Action Network is the largest funder of research in the country on the private side, and what they've done is every year they issue grants to medical researchers, and they try and do 2 to 3 a year, and they hold basically a contest for 10 or so projects, and they select with medical professionals to make sure that they select the ones with the most progress. And then these doctors use that funding to begin clinical trials on patients. And the hope is that they'll find a mix of chemotherapy, radiation, a new drug, whatever it may be, so that eventually we can start to increase the survival rate from the current 5 to 6% up to 10% to 20%, because the numbers are just so down, and we just don't have a great, there's just no great survival rate right now, and moving the drugs forward and making sure that, clinical trials are available in every state, every city, so that you have the best chance moving forward.
Okay. Now, Doctor, you said that you have options that you didn't have 10 years ago. So
Yes.
From that comment, I'm assuming there has been progress in the last 10 years.
There has been progress, not just in pancreatic cancer, but through the clinical trial network. There's a lot of progress being made. But part of the issue is that the funding for the National Cancer Institute has been severely cut. And these cancer research projects take multiple years, because what we're looking for is, on clinical trials, you need to have a group of patients who are treated with a new drug and a group of patients who are the control group, and then or treated with standard care. We don't do placebo trials where people get sugar pills. We just would never do that. But if you do those trials, you have to treat a lot of patients to know that it's not just luck, that it really is the effect of the new drug, and that the new drug is something that's tolerated. So patients are very generous to donate their time and some of their well-being to cancer clinical trials. But we also need the funding. And what we're seeing now, particularly with things like the sequester, is a lot of people who are 3 and 4 years into their research at the NCI are having to close down projects because the government, the Congress, has not given the funding to those projects. And that's just a shame. Because now with the new genetics that we're learning about the various genes that trigger cancer growth, we're just beginning to learn about this. There's going to be a tsunami of information that's going to come at us to help us know what triggered this cancer and made it grow. Because if we can find a gene that triggered it, then the pharmaceutical companies can find a drug that attacks or turns off that gene. It's working in breast cancer, it's working in lung cancer, it's working in melanoma, which previously was an untreatable cancer. It's in its infancy, but there is hope out there, and we do try to make sure that patients that we see have access to clinical trials when it's appropriate for them to do so.
Now, are there a lot of clinical trials available to people that are living with pancreatic cancer?
Unfortunately, not as many as we would like. And clinical trials have to start with years of basic science research, the type that's done at the National Cancer Institute in Bethesda, Maryland, where they can grow the tumors in test tubes and figure out what their genes are and figure out what the mutations in genes are. And so the pancreatic cancer is way behind a lot of the more common cancers like breast, lung, and colon. But hopefully, with efforts like PanCan and other efforts, hopefully from Congress, to actually fund some of these projects and do what they're supposed to do and pass the bills and get the money out the door so that the workers can do their work, we'll make some headway.
Now, what is the website to the New Mexico Cancer Center?
It's nmcancercenter.org.
Okay.
And our local phone number is 505-842-8171. So if people have questions, problems, call us. If you need help, definitely call us.
And I'm assuming you've got a lot of information on your website if
We
they have
do.
questions about different things. And what is the website to PanCan?
It's pancan.org. And they also just started a new campaign for the awareness side of their company called wagehope.org, and they just started that this month. It's a brand new effort towards raising awareness for pancreatic cancer. If you want to find us locally, we've got a great group of volunteers, and we love to take on more people because the more help that we have, the more people we can get to and raise awareness for this disease. So we have a Facebook page. It's PanCan Albuquerque at the end of Facebook.com. And then obviously polysrun.com has its own website, and you can find us there. You can find us through the national website. It's not hard to track us down. We try to make ourselves as accessible as possible. There's contact information there. There's information. So find us through one of those avenues.
And we do have a link on ours as well if people want to donate to directly helping cancer patients, to link to the New Mexico Cancer Center Foundation.
And they can also volunteer. That extends your life, and it certainly improves the quality of life. We're going to close with you, Alesia, to talk about, and we've only got a minute or maybe even less, hope. You have a mother, you've lost a grandmother to pancreatic cancer. You have a mother living with pancreatic cancer. How do you keep your spirits up? How do you continue to have hope in the face of statistics that aren't that hopeful?
Well, I've been recently volunteering with PanCan, and they're a great group of hopeful people. But my message to someone who's been recently diagnosed or a recent caregiver is don't lose hope. There is help out there. You just have to know where to find it.
And hope means a lot. Dr. Jurgen, I'm going to give you a couple of seconds to talk about just how important hope is.
It's crucial. It's what gets people up in the morning. It's what makes them eat when they don't feel like eating. It's what gets them to the clinic when they need their care. And we do everything we can to help with hope.
Okay. Thank you so much. I think this is a critical show. This is Carrie Brandenburg signing off the Women's Room. Please don't drink and drive, and don't let those you love and care for drink and drive. Carrie Brandenburg.